me say stuff, you'll probably want me to quit saying stuff. Okay. I want to send my greetings to those who are here in Okinawa who are live streaming this program. As you know, outside the window, a typhoon is really warming up for us. But I'm thankful to be inside in a peaceful and a safe place. If you're live streaming somewhere else in the world, happy Sabbath. And since it is a Sabbath here in Okinawa, I want to begin with a word of prayer. So if you could just bow your heads with me, we'll ask God to be with us. Father in heaven, we are thankful that there is peace in every storm. We'll be talking about some storms this evening. We pray that you would raise your hand as Christ did over the Sea of Galilee and say, peace, be still, whatever our storm might be, whether it might be a storm of disease of the body, disease of the mind, a disease of whatever is around us. We ask for your presence, we plead for your blessing, and we thank you for both in Christ's name. Amen. You know, this picture that you see in the screen is a really beautiful place. This is one of the further out islands in the Okinawa and the Ryukyu chain. But I'm going to look at a situation where there is a storm within. The number one disease killing people in America and in Japan is cancer. And we're going to start this meeting tonight talking about cancer. Basically, we're going to talk about cancer, heart disease, and diabetes. But I want to give you a little heads up. Whatever we say about any one of these diseases will help any one of the other diseases, and not just those three, any disease. You see, the body is fearfully and wonderfully made, and we've got certain principles by which we live. We don't live by medications, we live by principles. Now, since we're talking about cancer, first we have to define what is cancer. Quite frankly, it's a cell or an abnormal cell that's growing abnormally fast. In this picture, you see a tumor that's on the left knee of a young man named Francis in Yonga. The tumor that you see removed in September. 3 months later, how fast it cancers grow so fast, them grow. That leads as those who live up in the mainland because they've got Fukushima Daiichi in their backyard. But one thing about Fukushima Daiichi, the radiation it puts out has already been around the world and it's down here too. Lack of exercise, another big cause of cancers, and a weakened immune system. So those are basically a conglomeration of those things that most people blame our cancers on. Now we're going to look at them one at a time. So I'm going to ask you some questions. Can you do something about smoking? I did. April the 1st, 1973, I quit smoking. Can you do something about drinking alcohol? Yeah, what can you do? You can quit drinking this stuff. I did that too. How about genetics? Can you just take all your DNA out? No, if you did that, you're dead. But here's what we know about the DNA. There is a book written called The China Study. Dr. T. Colin Campbell and a group from Cornell University in cooperation with the Chinese government did about a 10 to 12 year study in China. And this was their outshot. It says, a vegetarian diet can control the expression of genes. And we sometimes have recessive genes that can express themselves, that can cause things like heart disease, cancer, diabetes, obesity, allergies, osteoporosis, and a whole plethora of diseases. And it's caused by genetics, but if we're vegetarians, those genes do not express themselves. So my thoughts are, let's don't be so worried about the genetics. Let's be worried about keeping our body strong. How about overweight? We don't need to talk a lot about overweight. Just quit eating that makes you cause weight. Eating between meals, eating too much, eating late, eating high-fat meals, eating anything from an animal is going to make you gain weight. But what about those cleaning products that we have in our home? My thoughts? Make your own. One of the best cleansers you can make is take vinegar, put lemon rind in there for about a week, take it out, put a few drops of oil of oregano in there, and you've got the most powerful cleaner that will kill anthrax and everything else, but it won't kill you. You won't like it if you drink it, but it's not going to kill you like some of your toxic substances. Baking soda, another great cleaner. That can polish your silverware, it can polish your pots and pans. It's the things that God gave us to take care of ourselves. Put that lemon in that vinegar and you're going to have a nice cleanser. So make your own cleansers. How about inflammation? There's things we can do for inflammation. One of the best one is curcuma. Many people call it turmeric. Curcuma is the phytochemical that's in turmeric that takes care of inflammation. Now, many people just take a spoonful and mix it in water and drink it. My recommendation is bring water to a boil, and people are going to say, how much water? Hey, this is not modern medicine. This is herbs. Doesn't matter how much. So let's say, all right, since you want me to tell you, how about a liter of water, quart of water? Bring it to a boil. Once it's slow boiling, add curcuma. You're going to say, well, how much? Doesn't matter. All right, add 2 tablespoons full. Stir it up, let it low boil for 10 minutes, take it off, let it cool, drink it within 3 hours. Fantastic anti-inflammatory. You don't like that? Try ginger. Ginger is also an anti-inflammatory. You don't like that? Take flaxseed. If you don't know that in Japanese, that's amani. These are all anti-inflammatories. Of course, the flaxseed, that also has omega-3 fatty acids. This is a high-fiber food. So what's going to be a triple winner for you? Okay, so, and every time I mention one of these things, I'm just talking about muy poquito, a tiny little bit of the things that you can do for these things. I'm just giving you sort of a push down the hill on your go-kart so that you can take this on to the finish line. How about eating not enough fruits and vegetables? Hey, I don't need to explain that. Quit eating meat, eat fruits and vegetables. It's not that hard to do. I've been doing it for about 35 years. Sometimes I'm not a good advertisement for being a vegetarian, but here's the reality. I've always looked like this. I'm a marathoner. Marathoners aren't supposed to look like Charles Atlas. And so whatever your weight's supposed to be, you maintain it best with a vegetarian diet. You don't have to worry about all these other things. All right, how about a weakened immune system, which most people have? One of the best herbs you can take is echinacea. Echinacea is a natural antibiotic. It's got all kinds of good properties in it. You just take some echinacea tea, it's going to help. Other things you can do, make sure you're well hydrated. Many people do not drink enough water. How much water should you drink? 3 to 4 liters a day. getting enough rest. If you miss your sleep by 2 hours, you've cut your immune system in half. We do not need a weakened immune system. And take no sugar. A little bit of sugar in your body starts to weaken your immune system. And get plenty of exercise outside in the sunshine and in the fresh air. Again, this is just a tiny bit of what you can do for your immune system. Keep your resting pulse rate under 60. Get plenty of that exercise and all other kinds of things. Okay, so we're not going to worry about that. How about not getting enough exercise? Do I really need to give you a class on that? You get outside and you start walking. Well, I don't like to walk. Well, if you don't like to walk, you're going to have to find time to get sick. It's one choice or the other. We get outside. All right, some people say, I don't like it. Well, my recommendation is take a bunch of little cards with things that you want to memorize. Why would you want to memorize something? Memorizing things makes your brain stronger. It sort of puts away Alzheimer's, puts away dementias. So if you start putting things in your mind, and walking at the same time as memorizing is basically much stronger medicine for making your brain stronger. All right? If you were strengthening your immune system, that takes care of the viruses. So bingo, we've taken care of that too. Now let's get down to ionizing radiation. Fukushima Daiichi, and not just Fukushima Daiichi, and not just Chernobyl. If there is a power plant, it is always emitting ionizing radiation. What can we do about that? See, in every situation, there is a solution. There was a doctor living in Nagasaki. I think he was a 29-year-old resident in the hospital in Nagasaki in 1945. His hospital was 1.4 kilometers from the hypocenter of the bomb that was dropped on Nagasaki. But the interesting thing was, and I believe God placed it in this man's mind to study radiation before the bomb, before they even knew there was such a thing as a bomb, because we're always receiving radiation. We receive it from the sun, we receive it from the ground, we receive it from x-rays. There are many different procedures that put radiation into the air. And he was studying how can we protect ourselves from radiation. And he came up with a solution. First of all, he said no sugar for anybody. Now, like I say, he was 1.4 kilometers from the hypocenter when the bomb was dropped. Now, and it was behind a hill, so none of his people got the direct effects of the blast. But that didn't kill the most people. What killed the most people was the radiation fallout. Not one person in his hospital, staff or patient, got sick because of the program he put them on. First, I've already said the sugar. Second thing, now don't worry about the exact thing. Look at the principle. He put them on brown rice. Now what's the principle? Whole grains. He put them on miso. Now miso has many good things in it. It's a great probiotic. It's got lots of good bacteria in there. And so he was feeding that to his patients. Sea vegetables, very, very high in minerals, especially iodine, which is probably one of the most carcinogenic of all radioactive isotopes and which is put out big time by Fukushima and Chernobyl. Then he gave them Hokkaido pumpkin. Okay, what's the principle? Whole food, plant-based. Don't have to eat Hokkaido pumpkin. You probably don't even know what a Hokkaido pumpkin is. So eat any whole vegetable, whole fruit. That's what he was looking at. And then he gave them sea salt. Sea salt, and now I would recommend Himalayan salt because it has all the minerals. We've got to replace the minerals. Now I'll explain why in a moment. Okay, August 1945, when the two bombs were dropped, it put out an amount of radiation. Radiation is measured in a thing called Becquerels. Becquerels is how many disintegrations per second that it goes through. For the two bombs, it was 60 times 15 to the 10 to the 15th power of Becquerels. That means every single second, that many disintegrations were taking place. Now, what does that mean? You've got this atomic an atom breaking down and is sending off what's called alpha and beta particles, which are basically electrons and neutrons and protons, sort of like a hand grenade going off, just shooting these things all over the place, which if they get into the DNA is going to cause the mutation. So we had a lot of radiation going on. Keep this in mind, 60 times 10 to the 15th power. Now let's go over to Chernobyl, 1986. Interesting, when I was in Ukraine some years ago, I met the president of the children of Chernobyl. The president of the children of Chernobyl had been a young man in Chernobyl when that reactor exploded. And they have an organization. Matter of fact, he gave me his medal that the Soviet Union gave him. I've got his medal that the Soviet Union gave all the survivors of this particular blast. But he told me some pretty horrendous stories. He showed me pictures that no one else has ever seen. Matter of fact, he said everyone who worked on the cleanup of that disaster died of radiation poisoning. So anyway, the blast happened. How many Berquells did that reactor put out? Well, it was 12,000 times 10 to the 15th power of Berquells. That is every single second was going on. Now, you might think, well, I'm glad that was so long ago, it's not a problem anymore. That will be a problem for the rest of time. It takes 50 to 100 years to finally make that reactor cool enough to completely shut everything down and get everything out. Fukushima Daiichi, no one here in Japan will be alive when it is finally to the safe zone. Of course, we'll be in heaven by then anyway, so we're not going to worry about it. But that is every single second those things are going out. When Fukushima Daiichi happened, during that big tsunami that went down, the explosion, they have to keep these reactors cool. How do they keep them cool? They squirt them with ocean water. Where does that ocean water go? Right back into the ocean. And so basically the ocean was polluted, the air is polluted. Now, I was speaking down in Osaka a few years ago, and they were sort of patting themselves in the back because the prevailing winds blow east. But it's interesting, when that reactor went down for 3 days, the wind blew south. So, Osaka, you got it too. You got sucked, Osaka. But we've got to understand a principle of health. The body wants the very best. We call it selective uptake. So here's 2 apples. Which one would you rather eat? Oh, you're saying you'd like to have the one on the left? Sorry, already ate it. You've only got the one on the right, and you're really hungry. Will you eat it? Yes, you will, if you're starving bad enough. That's the way the body is. The body wants the very best nutrients. It's amazing. You'll see alcoholics live for years on junk and alcohol, because alcohol is carbohydrates, gives them the energy. It's amazing what the body can do. But the body wants the very best. All right, so I've got the good apple and the bad apple. I'm just giving you a small part of this program. We're looking at sulfur here. Sulfur, if we don't have a good amount of sulfur, we're going to get sulfur 35, which is a radioactive isotope. Now, I've got a picture of the skin there. The skin needs sulfur. When I talked about this Berquells, the breakdown of these atomic particles, we call that a half-life. Within so many either seconds, minutes, hours, days, years, or millennia, these things will be half power left. For sulfur 35, the half-life is 87 days. That means if you get sulfur 35 in your body, in 87 days, half of it's still there. What happened to the other half? It's been sending off those alpha and beta particles all through your body. So where can we get sulfur? We get sulfur from cruciferous vegetables. We get sulfur from onions. We get sulfur from garlic. And don't stop the list there. Go online, find out good, whole food, plant-based. You can use the word vegan, that's fine. Vegan sources of sulfur, and make sure you're getting enough. Now, the most carcinogenic of all radioactive isotopes is iodine-131. We need iodine in the body. That is the good apple. But if we don't have enough, we have iodine-131. That's the radioactive isotope. Nice thing is the half-life is only 8 days. But the bad part is, anywhere there's a reactor, it's always putting out iodine-131. Now, when Fukushima Daiichi went down, and I come to I come to Japan every year. I told the people here, get ready, you're going to start having thyroid problems. How did I know? I spent a lot of time in Eastern Europe. The major problem I deal with there is thyroid problems. Well, here's what was in the Stars and Stripes not long ago. 25 times more thyroid cancer compared with before the disaster. 25 times more thyroid cancer. Hyperthyroidism or hypothyroidism is now in epidemic proportions in the Fukushima prefecture. So there's a problem. So we need to ask the questions, where can I find iodine? Well, in the sea vegetables. People say, yeah, but the sea's got all that radioactivity in there. There's other places you can find iodine. If nothing else, supplement with iodine supplements. Matter of fact, there was a doctor in Tokyo some years ago. He kept telling the government, stockpile iodine, stockpile iodine. You see, if you looked at go online, get a map of Japan with the locations of all nuclear reactors. The island is surrounded with nuclear reactors. It was only a matter of time before one of them tanked. We had our 3 Mile Island in America. They had their Chernobyl in Ukraine. You've got your Fukushima Daiichi. And folks, this is just the beginning. So go online. Well, what he did, he says stockpile. They didn't do it. As soon as that happened, you know what happened to the iodine stores in the world? They disappeared. People bought that up like popcorn in a movie theater which was covered with hot butter. They wanted the iodine in their bodies to keep from getting iodine 131. If you get iodine 131 in your body, where's it going to go? It's going to go to your thyroid. Why? Because your thyroid hormone is iodine. Well, iodine 131 is not iodine, but it mimics. It's the bad apple, and it will pass for iodine, and so it gets into your thyroid, and once it's there, you're going to start having thyroid problems. You're going to have nodules, you're going to have cancer, you're going to have hyper. So what can you do if you've got iodine 131 already in your thyroid? Well, there's an amazing little thing called charcoal. If you take some charcoal tablets every night, put them in your mouth between your cheeks and your gums, and just go to sleep with them in your mouth. As you sleep, they'll slowly dissolve. And as they're dissolving, you're going to be swallowing that saliva. And as those little charcoal particles pass through your esophagus, down through your thyroid, it's going to pull the thyroid iodine 131 right out of your thyroid and take it on out of your body. How does it do that? Well, it's sort of like a magnet. You realize as you move a magnet near metal, what's going to happen to the metal? Is at one point, it's going to be drawn to the magnet. That's what happens with charcoal. It's basically, as far as I'm concerned, a medicine that God gave us for the end of time. It can do so many good things. Okay, how about iron? What do you have if you don't have enough iron? Well, that's called anemia. And if you have anemia, it means you don't have enough iron, obviously. And so the body says, I got something, well, not the body, the radioactive isotope says we got one that will fit. It's called plutonium-238 and plutonium-239. Welcome to the body, folks. Now you've got this plutonium in your body affecting your lungs, affecting your blood, affecting your sex organs, and everything else that depends upon iron in your body. And we do not want that. How long is its half-life? Not days. How about 88 years? Now, there's a way to get these things out of your body. We've got to chelate radioactive isotopes. There's ways of doing this. But what we want to do is make sure the body has no parking place for them. So in this case, what do we have to do? Yes, right? Take more iron into our bodies. Where do we get that? Green leafy vegetables, tomato sauce. I had spaghetti sauce for lunch today. Spaghetti sauce. Any way you thicken those tomatoes, it has more iron. Blackstrap molasses. Now, many places I go, you can't find this stuff. But if you have a place where you get some blackstrap molasses, a couple of teaspoons, stirred in warm water at night, drink it, it's going to bring your iron up. Dried fruits, raisins, prunes, they're very high in iron. I recommend you take those things. Pumpkin seeds, very good sources of iron. But don't just take what's on this slide. Go online, look up sources of iodine right, iron, and find those things. So basically, radioactive isotopes should not be something we're concerned with. So on that list of things that people consider lead to cancer, what's left? Age. And folks, you can't change that. Well, really you can, because age is relative. My father was an old man when he died, and he was 57. My mother is still going strong at 90, and she's still alive at 95. It just depends on what's happening. So we're not going to worry about those isotopes, and we're not going to worry about age. Matter of fact, you know what age is? It's a reward for living a long time. Okay, another thing we got to worry about is this thing right here. It's called a free radical. What's wrong with that particular atom there? You notice there's a little dotted line? That means it's missing an electron. And when it misses an electron, it's going to go looking for an electron. First, we've got to answer the question, where do we get free radicals? You get it in bad air, a high-fat diet, eating too much, working yourself to a frazzle, radioactive isotopes, growing older. If you injure yourself, your body produces free radicals. So basically, we got free radicals all around us. So don't try to find out, where am I getting all my free radicals? Although we should try to get in the cleanest environment as possible. But God has given us a solution for free radicals. What is it? It's a thing called antioxidants. Ever heard of one of those things? All right, here's two atoms. The one on the left is an antioxidant. The one on the right is just a regular atom. But look what's going to happen to the one on the right. Uh-oh, it just lost an electron. Why did it lose an electron? I haven't the foggiest idea, but now that thing's a free radical. But God has a solution. Look what God's going to do. What's he going to do here? He's going to take an electron from the antioxidant and give it to the free radical. Now the free radical is no longer a free radical. But does the antioxidant become a free radical? That's the amazing thing is, God made it so that that atom can give up electrons all day long and never become a free radical. Why? He knew the world that we'd be living in. He's a good God. So where can we find antioxidants? Just look at your food. Just, matter of fact, some people say eat a rainbow of food every day. All right, that's a good idea. Not every meal though. We should have, just a few items in a meal so we don't overtax ourselves. But we need to be eating a lot. And basically, you're going to find antioxidants in fruits and vegetables. You're not going to find them in animals. So we want to get our foods there. All right, another thing. We're talking about cancer cells or cells that grow abnormally fast. Well, when a few cells get together, they start to form a tumor. At first, they're small tumors. They can sort of draw their blood supply from the surrounding tissues. But after a while, as they grow, they need their own blood supply. So they start putting out these angiogenic factors. This chemical it exudes that causes nearby capillaries to form a trunk line into the tumor. And now what do you have? You've got a tumor with its own dedicated blood supply. It gets the blood, it passes itself and the blood through it to other parts of the body. And this is what makes, basically, if you're working on brain tumors, so dangerous because it's so vascular. You've got a tumor that's so vascular and you cannot leave anything bleeding up there. And so we can stop this thing. There is a medication they give, but I'm against the medications. We can take things like grapes that has what's called COX-2 inhibitors. COX-2 inhibitors stop the tumor from producing these growth factors that causes the surrounding blood supply to build a highway into the tumor. So we can get it with red grapes. We can get it with curcuma, the turmeric I've already mentioned. We can also get it with soy milk. There's a number of ways that we can get these COX-2 inhibitors that will stop the production of this growth hormone that makes the tumor get its own blood supply. There's a basic law of health. Perfect health requires perfect circulation. You cut off circulation to the tumor, you've cut off life to the tumor. And that's what we want to do. Matter of fact, you can really do it. And this is maybe getting off in the left field here, but our minds can also control our blood supply. And I'm not getting into mystical medicine here. Our minds have a powerful effect. And I'm not going to go any further than that, but if we start thinking negative thoughts, we start doing negative things, we start having negative emotions, we're asking our body to grow fast-growing, abnormal cells. We got to quit doing this. All right, another thing that grows cancer is sugar. Cancer loves sugar. I was in Japan some years ago. There's a woman with breast cancer. And she came to us. We gave her some treatments, gave her some advice. Then she went to UT Pines in Alabama. When she came back to Japan, went to her doctor. He could not find the cancer. He said, I don't know. There's something wrong with my machine. Come back next month. She came back every month for 9 months until finally he said, yeah, you no longer have the cancer. And she did not. But she had a weakness. She liked candy. Now she got off candy because she knew it was bad. But then she thought, well, one piece won't hurt me. She liked it. She started eating candy again. I remember the last time I saw her. I went to her apartment. She was laying there on a couch. And if you do a line down through her body, the right side was all swollen. The left side was normal. I've never seen that before in my life. She died of breast cancer. It never goes away. I don't care what the doctors say. We got it all. They don't know they got it all. The body encapsulates the cancer, and as long as we take care of ourselves, the cancer cannot come out. But if we violate the laws of health, it can come out and get us. The average plasma cell will have 20,000 receptor sites for insulin. That's how sugar gets into the cell. But like I say, the cancer cell really loves sugar, so it's not going to have 20,000. It's going to have 15 times more, 300,000 receptor sites. So if you know somebody with cancer, what do you tell them? No sugar. I mean, no sugar in any form. I don't care. Someone asked me tonight, what about brown sugar? Brown sugar is white sugar with some molasses in it. No sugar. Another thing, and this one's sort of one that most people don't want to do, but the 2-meal plan is also protective. Not just for cancer, but I'll talk about cancer. If you're eating 2 meals and resting between 16 and 18 hours between the last one of the day and the first one of the next day, it does a lot of good for your body. But most people don't do that. All right? Most people, they eat their breakfast. Let's say you eat breakfast at 7 o'clock. You're going to be done by 7:30. Then you got to jump on the wagon and get to the work. So and then it's going to take you about 5 hours to get that food digested properly and to go through what we call the interdigestive phase. It's a phase where your body rests for an hour before it starts up again. But now we have lunch at 12 o'clock. Most places lunch is at 12 o'clock. So you eat at 12, you get done at 12:30. So now you've got to go through the same 5 hours again. Now you go home at nighttime and you've got your third meal at 6 o'clock. And the same thing goes on. So basically you're spending at a minimum of 15 hours a day digesting food. It takes a huge amount of power in your body to digest your food, to get ready to digest, and then to put away all those digestive juices. Those who eat two meals a day, they have 93% less cancerous tumors. Why? Because the body has the time to fight cancer rather than digesting food. It's common sense. Give your body a break. Let the body do what it's made to do, fight disease, rather than picking out all day long and expecting the medication to fix it. Other benefits of a 2-meal plan: better eyesight, better hearing, better intellect and memory. That's one we all need a little bit more of. Less allergies, and there's so many allergies in the world. Many of the allergies are caused by food. The less food you eat, the less time the allergy is going to express itself. Some types of major allergies, things like asthma, things like arthritis, these are allergies. We got to take care of those. Those on a 2-meal plan, they're going to have more energy and more endurance. Again, the body energy is being used not for digesting, but for motivating you around. So we need to sit there and take the 2-meal plan. Less obesity or just regular overweight. Hey, 2 meals, it's hard to get fat on that. Less osteoporosis. Many of the things we eat cause us to lose our calcium, which is going to increase our osteoporosis. Less stress. We'll be talking about stress later on in the program. Better control of diabetes. We're talking about type 2 here. We put type 2 diabetics on a 2-meal plan. They do perfectly fine. What does medical science do? Put them on a 5-meal plan. Crazy. Where's the pancreas out? Better control of high blood pressure, and it just helps us live longer. So those are some ideas. And I just gave you a tiny little picture on cancer. But if you just did those, let me just mention one thing I didn't throw in the program. If you know somebody with cancer, no milk. No, 0.9 cow's milk. It's got a protein in there or a hormone called insulin-like growth factor. Insulin-like growth factor can increase the replication of RNA, cancer RNA, by 10 times. So if you know someone with cancer, no milk, no cheese, no yogurt, no ice cream, no nothing that has milk in it. And if you look at most of your boxes of cereal, there's going to be whey or casein in there somewhere. You just leave that out. All right, cancer is the #1 killer in Japan and in the United States. The #2 killer is going to be coronary heart disease. We're going to look at coronary heart disease next. And again, like I say, I do the same little picture of coronary heart disease. What can we do about that? We can do something about being overweight. We can do something about a high-fat diet. Just quit eating so much fat. We can do something about not eating enough fruits and vegetables. We can do something about high blood pressure, which I'll give some suggestions on. One of which will be get more exercise. We can do something about that. We can do something about diabetes. Diabetes is curable. We can do something about stress in our lives. We can get rid of the tobacco in our lives. We can get rid of the alcohol in our lives. And basically this is just leaving 3 things. We've already mentioned that those things are things that we can deal with. The genetics, you cannot, I don't care what Bruce Jenner says, he's still a guy. I don't care what he calls himself Caitlin, he's still a guy. Just check the DNA. You cannot change your gender. They've got about 123 different genders. Know this too, male and female. Sorry about that. Put me in jail, I'm not politically correct. Okay, many people think that most men get heart disease. Well, women are catching up. Don't feel bad, women, you're catching up with men. High blood pressure is one of the main causes of heart disease, which we're going to basically talk about in this tiny little segment of this program. Diabetes opens the door. That will increase your risk of heart disease by 200 to 400%. Increases your risk of stroke by 200 to 400%. Increase your risk of kidney disease by 1,700%. We need to control diabetes. Another one is stress. Again, like I said, I'm going to mention a little, and I've got a whole program on stress. No time to give you all the things about stress, but there is one thing I want you to get in your mind about stress. High cholesterol. Where does cholesterol come from? It comes from the liver. It comes from your liver. It comes from the cow's liver. It comes from everything that has a liver that produces cholesterol. So if you want to lower your cholesterol, what should you do? Quit eating animals that have livers, and your body produces all that you need. Now, is heart disease reversible? There's a man named Nathan Pritikin. At the age of 41, this was in 1946, before heart transplants and bypass surgeries and all the other stuff, he was diagnosed with terminal heart disease. He was in pitiful shape. His cholesterol was over 300. The doctors told him, you're going to die, go home and get ready. Well, he had a choice, go home and get ready to die, or go to the library and start studying what country has the lowest rates of heart disease. Because if you want to not get heart disease, follow the people who don't get it. He found that the country at the time, in '56, the country that had one of the lowest rates was Uganda. So basically, he adopted the Ugandan lifestyle as far as eating. Well, what happened? By April 1958, he was a vegetarian. Besides that, he was running 6 kilometers a day. Not bad for a guy who was dying of heart disease just 2 years before. By May of 1958, his cholesterol was down to 160. What's the perfect cholesterol? 100 plus your age. So he was a little bit high for being, by then he was 44. Not too bad though. By January 1960, his cholesterol, it was down to 120. Yeah, he was doing really good. What was the diet he adopted? He had 10% protein, 10% fat, and 80% carbohydrate. Oh, we're told that carbohydrate, don't eat carbohydrate. The problem is the carbohydrates people eat are the highly refined carbohydrates. He ate a whole food, plant-based diet. And when he died 30 more years later, they did an autopsy and they commented they'd never seen such a young heart in such an old man, because he had changed his life and it had changed his heart. It'll do it. In the country of Iceland, they did an interesting experiment, 1981 to 2006. The mortality in Iceland was extremely high from heart disease. A lot of people dying. So they promoted 3 steps. And this wasn't a small study. This was the whole country of Iceland. And I've been to Iceland. It's a beautiful country. Here's what they recommended. Start getting more exercise. 2, go to more of a whole food, plant-based diet. 3, put out the cigarettes. That's all they did, those 3 things. And anyone can do those 3 things. What happened? Within a short time, heart disease fell by 80% in Iceland. Now, heart disease fell by 80% in the United States and in Japan. It would not even be in the list of the top probably 20 causes of death. It's amazing. We are killing ourselves with our lifestyles. But another thing, this sort of came out of the Korean War. During the Korean War, they had to ship a lot of water over there, and they cleaned the water up with chlorine. And I've got a book, it's Chlorine, Coronaries, and Cholesterol. They find that chlorine in the water increases cholesterol buildup in your arteries that leads to coronaries in the heart. And they did a study with chickens. Well, this is the study they did with the United States Army, unfortunately. But they did the study with chickens. They gave baby chickens 2 sources of water. One was pure water, one was chlorinated water. And they found that those who drank the chlorinated water, as they grew up, 100% of them had coronary plaques in their arteries. The ones who drank regular water, they had no coronary plaques in their hearts. Pretty interesting. And they probably ate the chicken for lunch, but that would have been bad for them. But basically, it's the chlorine in a water that's a poison to us. Chlorine and fluorine, both. Matter of fact, outside of every major city, when they go from chlorinated water to farm water or country water, cancer rates go way, way down. Chlorine is killing us. But most people, we're getting into high blood pressure here. Most people with high blood pressure, they will take medications. Will the medications that we take for high blood pressure cure high blood pressure? Not in 1,000 years. Medications do what? They control the symptoms. So, what are some of the things that affect high blood pressure? Why do we get it? Now, anything I show you that causes high blood pressure, just reverse that, and you are now getting a cure for high blood pressure. The first thing on the list, maintain a proper weight. Now, what's the proper weight? I'm not going to get into a debate about what's the proper weight, but you probably know. I usually tell people, if in some countries, stand up straight and then look down at your feet. If you can't see your feet, you're not at the proper weight. Your waistline, when we get into diabetes, you'll see what our waistline should be to be safe. But we need to maintain a proper weight. That's the first thing. Second thing, we need to move our bodies. A lack of exercise is one of the main causes of high blood pressure and heart disease and cancer and diabetes and osteoporosis and a host of other diseases. We need to move our bodies. I can't emphasize that enough. Some people say, oh, I'm too tired. The reason you're too tired is you're not moving your body enough. The more you move your body produces what's called a mitochondria. Mitochondria is a little power pack that we have in our cells. And the more mitochondria we have, the more glucose is converted into adenosine triphosphate, which gives us the energy. And so the more we exercise, the more energy we have to do more exercise, and pretty soon we're buff on the block and not just walking around the neighborhood 3 times, we're running around the country all over the place. Walking 3 or more kilometers a day compared to less than 1 kilometer reduces mortality by heart disease by a half. 3 kilometers? Just 3 kilometers versus 1? And we can all walk 3 kilometers a day. I knew a man one time, he got, I forget what the disease, I think he had a really bad, maybe Epstein-Barr virus, which really punks you out. But he knew he had to exercise. So for exercise, he'd roll off the couch and he'd crawl across the floor on his elbows. That's what he would do. And he did it every day, and pretty soon he'd get up on his hands and knees, and then pretty soon he'd go outside walking. We got to walk. We got to do it. Yeah, exercise also helps you, I've already mentioned, with diabetes. We'll talk about diabetes in a few minutes. But here's another very important point. Inactivity is an independent factor in heart disease. What does it mean, an independent factor risk? It means this woman that you're seeing right here has the same risk factors for heart disease as this woman right here. She's thin, probably has low cholesterol, but if she's inactive, if she's not going out there and moving that body of hers, she's got problems. Another big problem of hypertension, we all know that one. Matter of fact, it's salt. It's too much salt in the diet, excessive salt in the diet. If a person has high blood pressure, sometimes they're told by their doctor, eat less salt. But usually they're just giving a diuretic so they pee more, which gets rid of the salt from the body. But we need to get rid of all this salt in our body. Which means we've got to quit eating salty foods. Where do we find salty foods? Anything that comes in a can, unless it's marked low sodium, anything that comes in a bag or a box is going to be high sodium. Anything that comes in an udder is going to be high sodium. A mother's milk, human mother, 350 milligrams per deciliter of sodium in her milk. Cow's milk, 1,500 milligrams per deciliter. Whoa, they need a whole lot more. Now, when I was a child, we had a farm. I had 3 sisters. We used to go out in the field, and in one of the fields, there was this big white block. And they've changed the color now, but we used to love to lick that block. It was pure salt. We thought, it's nice our parents put this salt out there. Then we figured out when we got older, it wasn't for us. It was for the cows. The cows need more salt. We were licking the cow's slop all over the thing. But the salt causes us to hold moisture, hold water, which causes swelling of the tissue, which presses on the capillaries, which makes the heart work harder, which makes the blood pressure go up. Simple as that. So how much do we need? Well, they say 1 to 2 grams, which is about 2/5 of a teaspoon per day, is about the max you should have. Most people take a whole lot more than that. Matter of fact, upwards of 8 or more grams of salt a day. All right, water drinking. That's another important one. Some people say, I don't like water. Well, this is the Loma Linda study. And one of the things they looked at is how much water they drink. So they looked at men and women drinking 2 or less glasses of water per day. They had a relative risk of dying of heart disease of 1. Then they looked at people who were drinking 5 or more glasses of water per day. For women, it was 41% less. For men, it was 54% less deaths, just drinking a little bit more water. But some people don't like water, so they drink other things. So they looked at other liquids. Most of these liquids being diuretic themselves. Coffee, teas, colas, they are diuretic. And so those who were drinking 2 or more glasses of other liquids, relative risk of 1 of dying of heart disease. Those who were drinking 5 or more of the other liquids, women, 147% greater risk, men, 46% greater risk. That is a big risk factors. What do we need to drink? We need to drink water. How much? 3 to 4 liters a day. That's what we need to drink, especially in these hot places like Okinawa. If you drink 1 cup of coffee, it will raise your systolic blood pressure, that's the high number, by 5 to 6 millimeters. You say, well, that's not a big deal. Yes, it is. If you can lower your systolic by 3 millimeters, you reduce your risk of strokes by 11%, your risk of heart attacks by 7%, your risk of dying of all causes by 3%. That means every time you drink a coffee, you are raising your risk factors for those very things. And you don't want a stroke, you do not want a heart attack, and you don't want to be dead either. How can you lower your blood pressure really fast? When it's typhoon is gone, you go outside and you get in the sunshine. If you exercise in the sunshine, or just in the sunshine, you're going to lower your blood pressure 8%. Exercising, lower another 7%, basically lowering your blood pressure 15% by taking a walk in the sunshine. 15%, we're not talking millimeters here, we're talking percentage points. And that's going to extend for a number of hours after your time out in the sunshine. What does the sunshine do? It dilates your blood vessels, which increases your blood flow, which takes the pressure off your heart, brings your blood pressure down. All right, stress. Usually if I ask in an audience, many times I ask audience, especially in Japan, I ask questions, they all just sit there like cigar store Indians, which is fine. But if I ask them how many of you feel stress, almost every one of them is going to raise their hand, because we all feel stress. There's a certain type of stress. It's called white coat hypertension. What is white coat hypertension? You go to the doctor's office, everything's fine, and then the white coat walks in, and your blood pressure goes up. Why does it go up? Well, for a few reasons. One, sometimes the doctor's coming to give you bad news, so you're expecting bad news. Or it might be the doctor's going to do some painful thing on you, like stick needles into your body, or he's coming with the bill. Now, if you're in the military, not the big problem there, but it causes pressure on the person just from seeing the doctor. This is basically it's all in the mind. But stress is a reaction to stressors. We've got stressors. All of us have stressors in our life. And I once had a stressor in my life. I was living out in the farm in Missouri, and my stressor was a whippoorwill. Whippoorwills are nocturnal. In the daytime, it was quiet, beautiful out there. Sun would start to set, lights would go out outside, time to go to bed. I'd turn up my light. As soon as I turned out my light, it seemed like that bird woke up. And when that bird woke up, it would start to sing. And this is what a whippoorwill sounds like. How many times did it do that? Someone once counted how many times did it do that before it stops. They counted 1,088 times. Takes a breath, starts again. It did that all night outside my window. Talk about stress city. Now, 44 years ago, this was me in the northern training area of Okinawa. I was a rifle platoon commander. And I'm good with guns. I mean, I shot in the Marine Corps championships. I know guns. I had a double-barrel shotgun. I could never get that bird. It was dark out there. And then one day, I was living in the state of Missouri. There's a conservation magazine called the Missouri Conservationist. Every farmer receives one. I was a farmer. I don't know what I was farming, but I received it. And in that magazine that month, there was an article about that bird. And I was hoping, how do you kill that bird? Well, it told me something more interesting. That bird's favorite food. You know what the bird's favorite food was? My greatest enemy, mosquitoes. Matter of fact, this is what it said in that article. A whippoorwill in one night eats more mosquitoes than a purple martin will in a lifetime. And when I heard that, my whole mind changed. That bird never again bothered me. I still love to hear the whippoorwill outside my window because I know what he's doing. He's saying, come here, mosquito, come here, mosquito, come here, mosquito. And he's eating those mosquitoes. I never again disliked that mosquito, that bird. Matter of fact, I love that bird. What changed? I changed. You cannot change all your stressors. You cannot change the traffic in Naha. You cannot do it. Just go with the flow. You can't get upset with what someone says. The only one that can upset you is you. If you let anyone else upset you, if you let circumstances upset you, you need to go back to kindergarten and start over again because you forgot how to live your life. And I'm talking to myself here. We've got to allow ourselves to realize that all things work together for good to those who love God. No matter what the circumstance is, no matter what the tragedy is, God is in charge. Now, there are medications I do recommend for high blood pressure. You got to fraction the dose. You don't want to take a whole watermelon at one time, but watermelon is a great diuretic. You can eat the flesh of the watermelon. When you do, save the seeds. Clean them, dry them, grind them up later on. You can make watermelon seed tea. It's a diuretic. It's good for high blood pressure. During corn season, the corn silk, you can make corn silk tea. Dry the silk in the winter time, or no, have winter here, whenever the corn's not growing, make the powder, Boiling water is a diuretic. Another one is dandelion roots. Dandelion roots are a great diuretic, very good for high blood pressure. The leaves are good for everything else. Matter of fact, I recommend you eat the leaves. The liver loves bitter things. The leaves are a little bit bitter, great for your liver, high in calcium, high in protein, high in a lot of other things. When I was in Ukraine some years, the first time I went to Ukraine, a lot of high blood pressure, a lot of overweight people there. Some women would come to our meetings, 200 over 100. And our recommendation was, on your way home, get apples. And what you do is you eat apples, nothing but apples, for 3 days. That usually brings blood pressure down. And then once it's down, then you adopt the lifestyle that's going to keep it down. Low salt, drink your water, get exercise, and all those different things. Okay, I mentioned Iceland. There's another country, Finland. Finland had a very high rate of heart disease deaths. So they just got 30,000 people in their study. Iceland did the whole country. They got 30,000 men and women who were convinced to make 3 lifestyle changes. First one, it was to quit smoking. A lot of smokers in these Scandinavian countries. 2, lower the blood pressure. And 3, eat a low cholesterol diet, basically a whole food plant-based diet. What was the results? For men, this is amazing to me, they had 55% less deaths of those men who were in this program, just doing those 3 things. For women, they had a 70% reduction of deaths in the women who just did those 3 things. We can all do those 3 things. There's no reason in the world we cannot do those 3 things. Now we're going to go to a short little dissertation on diabetes. Diabetes is a threshold disease. If you have diabetes, you're inviting every other chronic disease into your body. Strokes, heart attacks, cancers, infertility, impotence, amputations, wounds that won't heal, so many problems just from having diabetes. So how do we know we have diabetes? Well, we can take a blood test. Our fasting glucose should be between 70 and 85. That's only measuring the last 12 hours. There's another one called hemoglobin A1C. That's looking back 3 months. You can't hide now because we're looking back 3 months. You've been cheating on yourself because, see, sugar is sticky. It sticks to the plasma cells. It's measuring how much sugar is stuck to the plasma cells. If you're between 4 and 5.6, you're good to go. If you're between 5.7 and 6.4, we have a name for that. That's called pre-diabetic. Now, I've been a vegetarian for many, many years. My sister thinks I'm a wingnut. But I was with my little sister a few years ago, and she had gone to the doctor for a physical, got her blood lab results, and he wrote on her blood lab results, pre-diabetic. You know what she did? She came straight to me. She said, "What can I do?" Yeah. See, now the roosters come home to roost, or the chickens that come home to roost, however you say that. And she was in this area right here, and I told her what she had to do. Because if you are over 6.5, you've got type 2 diabetes. I say type 2 because there's 2 types. There's type 1 diabetes. We call that IDDM. It stands for insulin dependent diabetes mellitus. What does it mean, diabetes mellitus? Basically, it's words that mean sugar flowing through the body. The old-time doctors would diagnose diabetes by tasting your urine. If it was sweet, it means that sugar was passing through your urine. You should not have glucose in your urine. But if you do, but a person who has IDDM, that's a whole different disease. What causes type 1, and another word for that, we call it juvenile diabetes. Many people call it, say this is a genetic disease. They did an interesting study. They got a bunch of rats together. They crossed them until the whole flock of rats, herd of rats, wherever they are, they all were diabetes prone. Then they had a bunch of babies born one day, and they separated them into 2 groups. The one group, they drank their own mother's milk. How many got diabetes? 0. Now they all had the predisposition, genetic predisposition. The ones who were artificially fed cow's milk, how many got the diabetes? 100% of them got diabetes. So basically, One of the causes of type 1 diabetes is early exposure to cow's milk. Don't feed your babies those formulas with cow's milk in them. It's not good for the body. This is not a disease of the endocrine system. This is an autoimmune disease. Basically, the protein in casein is made up of a 17 amino acid peptide chain. The protein in the islets of Langerhans that makes the insulin in our pancreas, same makeup. And so when the casein gets into your body, if your body's resistant to it, it makes an antibody that will go looking for 17 amino acids. Gets down to the pancreas, it sees the islets of Langerhans, it kills those beta cells, you're now type 1 diabetic. Bad news. Autoimmune disease. Type 2 diabetes, that's about 90 to 95% of people with diabetes are going to have type 2 diabetes. Pancreas, working fine. It's producing plenty of insulin, but the problem is it's getting worn out. It's producing insulin all the time. And it's not made to produce insulin all the time. As a matter of fact, if it's producing insulin all the time, insulin makes you hungry. Okay, that's another deal. Okay, so let's look at some of the factors in type 2 diabetes. First one is going to be overweight. It's amazing how many diseases we find overweight playing a role in the diabetes. But if a person is overweight, they are inviting diabetes. That's the first thing. If you have any one of these things, you're on your way. Okay? How can we control overweight? Well, if whole food, plant-based diet is the best way. Overweight is the most powerful modifiable risk factor for type 2 diabetes. Eat less, 2 meals a day, whole food, plant-based, no animal products, no fat in your diet, and you're going to be good to go. If you are overweight, which usually means you're over-nutriented, you're taking too many nutrients, the next thing it's going to happen is called carbohydrate intolerance. Now the body's saying, hey, you're just putting too much stuff down here. We're going to stop taking in these carbohydrates. You're not going to digest them, which then is going to cause other problems like you're tired all the time. You've got fuzzy thinking. You crave sweets. You've got digestive problems. This is some of the signs of carbohydrate intolerance. The next thing that's going to come is insulin resistance. Now, because if you become carbohydrate intolerant, that means the cells are no longer taking insulin. It's not good. They're closing up their insulin receptors. I mentioned insulin receptors with cancer. Your average plasma cell will have 20,000 insulin receptors. But if you are insulin resistant, you no longer have 20,000. You're going to go down to something more like 5,000 insulin receptors. Now what happens? Now when all that glucose is in the body comes knocking to get into your cells, there's no way to get in. So if the glucose is not getting into the cell, what is the cell going to do? It's going to send a message. It's going to send a message to the brain. And what's that message going to be? Feed me. And so a person who has diabetes has what we call polyphagia. They're always hungry. They always got to eat. But if you're always eating and you've got insulin resistant, that leads to another problem. All that food you're eating is building up sugar in your bloodstream. Now you got it too high, so now you're going to have what we call polyuria. You're always going to be dumping the sugar through your urine into the toilet. But that's going to lead to the third problem. You got polydipsia right there. You got polyphagia, polyuria. Now we got polydipsia. Because of the fact that your body is 93% water, your blood is 93% water, and you're peeing it all down the tubes, now you're going to have polydipsia. You're thirsty all the time. Those are the three big signs of diabetes. If you're always hungry, always thirsty, and always urinating, it's a red flag. Have it checked out because you just may well be on your way, if you're not already there, to diabetes. If you have insulin resistant, the next stop is diabetes. Doesn't stop there. Then comes heart disease. Doesn't stop there. Then comes cancer. Okay, there's another sign of diabetes. Diabetes is called the metabolic syndrome. See, type 1 was an autoimmune problem. This is a metabolic problem. 6 signs of metabolic syndrome. One is abdominal obesity. We should have men 102 centimeters around the waist. That's measured at the belly button, not down there where above where the whole flab hangs over. Women 88 centimeters. Frankly, these are too big, but that's what they say. Second one is your body shape. Which is the healthier shape for the human body? Well, the pear shape is the healthiest amongst the two. I tell people, okay, and they always just give us the two options. You want to look like an apple carrying all your weight up here, or a pear carrying all your weight down here? No, how about being a banana? That's the healthier weight. That's the healthier style. But move towards the pear, and then pare down your pear and get down to the banana. The third one will be a high systolic or high diastolic, or you're taking blood pressure medications. All right? And this study basically says if you have any one of these factors, you are one step closer to having diabetes. The next one, abnormal blood fats, your HDL, your good cholesterol, is going to be low. Another one in there, number 5, is going to be your triglycerides are going to be high. Where do we get triglycerides? That's the refined carbohydrates. How do we lower the bad cholesterol? Exercise will do it. Eating a lot of fiber will do it. Matter of fact, oats are very good for lowering those LDL. How do you raise your HDL? Exercise raises your HDL. And number 6 is going to be your fasting blood sugar over 100 milligrams. So you don't want to have a high resting blood sugar. Now people blame type 2 diabetes on diabetics. Well, there's an interesting study done with the Pima Indians. Now the Pima Indians are an indigenous American group. They weren't Indians. The reason why they called them Indians is Columbus thought he got to India. He didn't know he got to America. So he could have called them something else. He could have called them Americans. But they called them Indians, thinking he was in India. But they were Native Americans. 700 years ago, the tribes split. Half of them went to Mexico, half of them stayed in the southern United States. Now there's a very famous Pima Indian that every Marine should know. They called him, on Iwo Jima, his name was Ira Hayes. He was one of the flag raisers. But since, I don't know who all you are out there, but there's another very interesting flag raiser. That was Harry Hansen. Why is he interesting? He was a Seventh-day Adventist. Yeah, came from a Seventh-day Adventist family, Seventh-day Adventist schools. Joined the Marine Corps for World War II. He didn't get off the island alive. Matter of fact, 3 of those men never got off the island alive. Anyway, they split. That tribe split. Some of them stayed in southern Arizona, which is now around Phoenix, Arizona. I worked with the Peeposh and Pima Indians and other Indians in that area. But the ones who stayed in southern United States, almost all of them are overweight. A lot of alcohol, and over 50% of them are frank diabetics. Their cousins, same genetic pool that they came from, who now live down in Mexico, who are farmers who eat meat every 2 or 3 months. They eat corns and beans down there. Less than 10% of the people have type 2 diabetes. Same genetics. What's the difference? It's lifestyle. So what can we do? First of all, we've got to get our weight under control. And how do we do that? Too much fat in the diet, not enough fruits and vegetables in the diet, not enough activity in the diet. They did an interesting study. A 2-week study putting a group of people on 65% of the calories coming from fat. Now, I'm not saying they're drinking olive oil all day, but they're eating fatty foods. Just 2 weeks. At the end of 2 weeks, every single one of them was pre-diabetic. Every one. Now they reversed it immediately. They got off the fat, it reversed. And that's what you can do. So we need to stay away from the fat. See, basically, sugar is the symptom of diabetes. Fat is the cause of diabetes. If you have diabetes, if you're afraid of getting diabetes, you eliminate the fat. What about some olive oil? What did I just say? Eliminate the fat. I mean, if you're thin and you don't worry about diabetes, you can take a little bit of the stuff, but my suggestion is fat is a refined product, it's a concentrated food, just eat a little bit. Now, if you like fat, eat nuts, eat avocados, eat olives. That's the way God packaged it. Those are healthy foods. Another problem with diabetics is they're not getting enough sunshine. We've been made to fear the sun. We plaster ourselves up with carcinogenic laden sunblocks. We get out in the sunshine, we just have all kinds of problems. But the thing about the diabetics with the sunshine is 60% of diabetics have low vitamin D. Matter of fact, vitamin D is becoming a major problem in our society. We just don't get enough sunshine. Okay, another thing, many people have sedentary work. You need to move. If you've got, matter of fact, if I have a diabetic patient, here's what I do, very easy. Outside, sunshine, exercising, a whole food plant-based diet, no fats. That's the main things I do. Yeah, they're going to drink the water, but those simple things. Here's an interesting study here. If people exercise 30 minutes a day, reduce their weight 5 to 10%, which is not hard to do, they can reduce their risk of diabetes by 58%. Now, if you have diabetes, your treatment is do the same thing. If you reduce the risk, maybe you're going to reduce the exacerbation of the disease by the lifestyle you have. I believe that every disease is curable, and the best cure for any disease is go back and practice the prevention. Is there other treatments for diabetics? Yes. We've already mentioned increased in fiber. The more fiber in your diet, the slower glucose is released into the body, the slower insulin is released into the body, so you never get those spikes, and you sort of ride that wave very nicely. So a plant-based whole food diet. Another interesting study was done adding beans. People, diabetics, both type 1s and type 2s, on a diabetic diet, but they added beans to 1/2 of the people, 6 weeks on a diet including legumes. At the end of the study, they had lower blood glucose, lower urine glucose, and lower cholesterol than the other group, or control group on a diabetic diet. We need to eat beans. Matter of fact, at HEW Pines, our diabetics get beans every meal. Not a great big bowl of the things, and not, baked beans. I love baked beans, but they got sugar in them. Basically, we give them fava beans is one of the ones, which I don't like. I'm going to Bolivia. That's the main bean. But anyway, beans are good for you. Cinnamon is an excellent medication for diabetes. Now, you've heard that cinnamon is bad for you. Get Ceylon cinnamon from the country of Ceylon. It's much better. It lowers blood sugar levels, which you want to do. It is anti-inflammatory. Diabetes is an inflammatory process. Matter of fact, they measure inflammation with a thing called C-reactive protein. It's a blood test. People who go to church on a weekly basis have lower C-reactive protein. So diabetics should go to church every week. Improves sensitivity to insulin. If your body's insulin insensitive, that means insulin resistant, cinnamon can make it less resistant and start taking the insulin and the glucose. You don't like cinnamon? Try ginger. Ginger also lowers blood sugar. It's also anti-inflammatory. It lowers cholesterol levels. So God's got the medication out there, and they're really tasty medication. We use ginger for people with upset stomach. If they're on, we get a patient that they've been taking chemotherapy, they're upset all the time, we just make ginger tea. Great for settling the stomach. Okay, do lifestyle changes really help with diabetes? 2 case histories to end this program. Number 1, he was a male, type 2 diabetic, 268 pounds. We've had patients come, we had to get 2 scales. They had to put 1 foot in each scale, they were so big. Insulin, 175 units a day. Glucose was 350 to 400 milligrams, uncontrolled. He had already had 2 heart attacks. I said diabetes leads to heart attacks. He had high blood pressure on medications for high blood pressure. His blood fats, his cholesterol, his LDL were too high, and his kidneys were already in failure. Hey, you got diabetes? Kiss those kidneys goodbye if you keep it, because that's what's going to happen. Okay, in 5 days, glucose down to normal, lost 10 pounds, 130 units of insulin. How do we do that in 10 days? Now, don't you do this, but at HEW Pines, unless you can control the person very well, they fast for the first 5 days. no food at all, just water. We monitor their blood pressures, we monitor their glucose for 5 days, and then we put them on a green diet. So after 2 weeks there, he had lost 15 pounds, down to 58 units of insulin. Now he's a type 2, but his body needed the insulin. After 4 weeks, 1 month, he was no longer taking any insulin. He lost 24 pounds, and he was no longer on blood pressure medications. All right, now he goes home. Now that's where the rubber meets the road. You're going to stay this way at home, or you're going to go back to the pigsty like you were before you got down here. He stayed with the program. After 5 months, he was on no medications. His kidneys were completely healed. He was blood pressure 120/80. He'd lost 60 pounds. That guy was one happy camper. Second patient, he was a type 1 diabetic. He was overweight, which is sort of a rare thing. He was type 1. His taking 70 units of insulin, and his glucose was all over the charts. It was like a roller coaster, up and down all day. He could not control his glucose. You do not fast a type 1 diabetic. You can't do it. So we keep him on the food, but we put him on the green diet, very careful diet. After 2 weeks, down to 56 units of insulin, glucose was stable. After 1 month, 32 units of insulin, glucose still stable. He'd lost a lot of weight. He was in good shape. That's about as good as it's going to get at this stage in the game with type 1 diabetes. So basically, cancer, heart disease, and diabetes, they are lifestyle diseases that we can treat with lifestyle. If we got them with lifestyle, we can treat them with lifestyle. I hope this has been beneficial for you. I hope that you will be able to help yourself, and the whole purpose of being in this life is to help somebody else. God bless you, and I hope we meet again some other time.
Question time?
Question time. Okay, question time.
Okay, you were mentioning the sugar part. You said all white sugar, brown sugar. So what about the substitute? What's that stuff we take, Kim? We drink, use, what is it?
Stevia is fine.
No. Agave.
Agave nectar is high fructose corn syrup.
So that's bad.
That's bad. As a matter of
what's
fact,
that
high
stuff you
fructose
said?
corn syrup is the worst that there can be. It's
Stevia?
got a lot of, it's just say no for agave. Unless you found a much better source. They say it comes from a nice desert plant. From what I have studied and read, it's high fructose corn syrup. It's not healthy. High fructose corn syrup is metabolized in the liver and does not get out of the liver. It causes fatty liver. Fatty liver looks just like cirrhosis of the liver. It's best not to take anything that's HCFC.
So stevia, what is
HFCS, high fructose corn syrup. Yeah, it's bad stuff.
Okay.
You want to sweeten something, dried dates, any dried fruit. You want to sweeten your tea, stevia. That's the best thing. Stevia is a very healthy herb that doesn't have any side effects, but it is sweet as all get at.
Dry dates powder.
Dry date powder, yeah.
Where can you locate the stevia? Where can you
Yeah,
get
that's
it?
a concept.
It's pretty common in most places. Now, I don't know where I'm in Okinawa. I couldn't tell you that, but it's become.
It's a sweetener. Right?
It's a sweetener. It's an herbal sweetener, and no calories, but it is sweet, sweet. Matter of fact, I used to get in this little bottle, and it has this little tiny spoon in it. You can put a hummingbird egg in it, that's what you take and put in a cup of tea. All the sweetener you want. Yeah, it's really good. And stevia regulates your blood sugar. If you're hypoglycemic, it brings it down. Hyper brings it down. Hypo brings it up. It's God's medicine. It's a plant. You can grow the plant. But they've gone to a processing now that it used to have a little bit of you drink, that's good, aftertaste. Not bad, but wasn't the best. Now there's no aftertaste. Just amazing stuff. Any other questions?
Someone has a question, but they haven't said what it is. I have a question. Okay, what is it?
You talked about it's better to not to give formula to babies. But then if a mother is drinking, it's having animal products, like not all the time or once in a while, and still breastfeeding the baby.
Yeah. Anything the mother puts into her body goes into the baby's body.
So
And a study I read just the other day, and I'm forgetting exactly all the details of it, but basically the mother is passing on the cow's milk through her milk to the baby, the things that the baby did not need. So basically, when a baby's nursing, the mother's got to be very, very careful. And not all formulas have animal products in them. But you've got to read the labels. And sometimes you got to read it with a medical textbook next to you to figure out what all those things are. Because they have a way of hiding dairy products in 1,000 different words. You just have to be very careful. Usually hypoallergenic baby foods will be casein free because so many people are casein or lactose intolerant. But yeah, we had a couple from Singapore as students at UT Pines years ago, and we had another couple from Romania, or she was from Romania, her husband was from Canada. But the woman from Singapore is very sickly, and she had a baby, and that baby, was not doing well. So she'd take that baby every day to the Romanian woman who had just had a baby. That baby tanked up really good with that stuff. And one on one, one on the other, and they grew just fine. They used to call those nursemaids. Yeah.
I have a question for you. We've heard a lot on multiple sessions about the 2 meal a day plan. For many of us, that's a challenge.
Yes, it is.
2 meal a day. Is there anything that you can prescribe to help while trying to implement that 2 meal a day? Is there a way to overcome the cravings that oftentimes overtake us?
Well, all right, and that's an excellent question. We crave things we become habituated to. I used to crave tobacco, craved alcohol. You crave things that you become addicted to, or I don't want to say addicted, but we become habituated to. We get in the habit of eating 3 meals a day. To leave off that third meal, we think we're going to die before breakfast. Now, the problem you run into in most societies is lunch hour is 12 o'clock. If you eat your lunch at 12 o'clock, no matter what it is, by 7 o'clock at night, you might just start feeling a little bit hungry. My recommendation there is eat a little bit. But really, when you start to get dehydrated, which most people are chronically dehydrated, in the evening time, your body's sending signals, I'm thirsty, your brain's reading, I'm hungry. And you eat rather than drink. So my recommendation is at nighttime when you feel hungry, try drinking a glass of water and see what that does. Especially a cold glass of water, because that's going to put out the desire. And I find if I do that, there's no problem. Now, the ideal thing is you eat a good breakfast and a lunch about 6 or 7 hours later. You're not going to be hungry at the evening time. It's just not going to, because the body can't handle that. Eating your vegetable meal at breakfast and your fruit meal at lunch, because to me, I digest my vegetables take longer to digest. And so I got a longer span in there that I'm going to be sustained with my food. My fruit digests easier, and so I'm not going to bed with a full stomach.
I think because you're eating the vegetables first because of the fiber, you get them more fuller.
Well, you got fiber in fruit too. You should. Unless you're just drinking orange juice.
I have 2 questions. There's a question from online. I can't pronounce this word. Diatomaceous earth?
Diatomaceous earth.
Yeah.
Diatomaceous. I've got a 50-pound bag of it at my house. Basically, my friend, she feeds her husband every morning, stir it in a glass. He says, all right, time for your mud. It's very good. Because basically diatomaceous earths are diatoms, which are basically the skeletons of ancient plants. And when you take those into your body, it will cut to pieces any parasites in your body. That's the main thing I would take diatomaceous earth for, is parasites.
Is that a common type herb?
They mine it. And it's cheap as dirt. Matter of fact, I bought this 50-pound bag. It cost me far more to ship it to me than it was for the diatomaceous earth. I think the diatomaceous earth, 50 pounds, something like $32. About $50 to ship it to my house. And but that'll take me. Of course, I'm one of the kind of guys I buy this stuff, but I never take this stuff. So I got this 50-pound bag I've been dragging all over the place. I need to start taking it when I get home. but it's very good for parasites. And there's probably other good properties, but the main thing I would take it for, because probably almost everybody today has some parasites in their intestinal tract. You can take it, and if you have an anthill, you put it on the anthill, you put it anywhere insects are, because what happens is they get this, and it's fine as dust. It gets in between their little joints, and they move, and it just cuts them off. It'll cut that little thing to pieces. So you're taking it, and let's say you've got some roundworms or some pinworms or some flatworms in your intestinal tract. They're going to be cut up in little pieces, and you're going to be leaving them in the toilet.
There's another question. It says he and his mother checked glucose using a glucose meter.
Glucometer, right?
And the results made my mother say that he had low blood sugar, but when they got to the hospital, his blood sugar was normal. The family's confused about that.
Well, there's going to be a few things there. Maybe the glucometer that the person used wasn't working right. Maybe the reagents that they used it hadn't been properly calibrated. Maybe he was hypoglycemic for a while because he hadn't eaten for a while. There's many reasons why we get hypoglycemia. It's not something to be becoming alarmed about unless you're hypoglycemic all the time, and then you're tired all the time, no energy all the time. So, I mean, if you take a glucose reading and I don't know why he went to the hospital, but if it's just because the glucometer says he's hypoglycemic, it's certainly not a reason for a trip to the hospital unless they've got a really good glucometer and it's below 30. Then you got a problem. But if it's down in 60 range, well, eat some carbohydrate. Eat a piece of bread. Don't go out and eat a bunch of candy, but just get something to get some more glucose in your body. But how do you feel? Always listen to your body. Sometimes the machines that we have, even blood pressure cuffs, they need to be calibrated. Most people don't calibrate their blood pressure cuffs. So we take it every day. Oh, my blood pressure is normal when it might even be high.
Okay, that's it.
There's a question from someone watching online.
Mm-hmm.
You have mentioned 1 tablespoon of papaya seeds last night.
Right.
Is it from the raw papaya fruit that we eat?
What other papaya is there? You cook them?
Well, probably she thought you can purchase the papaya seeds.
Well, I've never seen them for sale. I mean, if you can find them for sale, I'm sure that would work. But in a place like this, you probably have pretty common to have papayas around.
Yeah, it's difficult to find the fruit papaya. Like, it's not that common, but there's a lot of green papaya.
Well,
I thought it was a lot of yellow papayas here too. I mean, we go to San A, we do see papaya.
right now.
in the San A.
Okay.
All right, let's get back to the reason. I always go back to the first question. Why do we want to have the papaya seeds? Okay? I said that I take them when I'm in an area with malaria, because malaria is a parasite that can be killed by papaya seeds. If you don't have papaya seeds, you can take artemisia. Another word for artemisia is wormwood. There's many other parasitals out there that we can take, and we can't find the papaya seeds. But in most places I go, when you get a papaya, you cut open, there's those black slimy seeds.
Yep.
And so you just sit there and take a deep breath, and you put a spoonful in your mouth, and you chew those, and they're hot. They're peppery.
Whole?
Huh?
You can't just swallow them whole?
Not
Swallow
unless you
without
want to.
chewing them.
You'll be laying little black eggs in about 18 to 30 hours. So my recommendation is we chew those things up, we fracture them so we get that properties inside the seeds that will kill the parasites, and then we scoop them over and get a piece of that delicious flesh. And to get that, it makes you forget the memory of how bad those seeds were. And the seeds aren't that bad. It's just that when you think about papaya and eat those seeds, you say this doesn't even make sense here, because they're peppery, they're hot. You just chew them up, swallow them, eat some papaya, everything's good to go.
There's another question. Is there any type of sweetener that is healthy? For example, is palm sugar okay?
It's sugar. Now, I don't know in what stage. I mean, let's just think about cane sugar since you got a lot of it around here. You go out to the cane field, you cut a piece of cane, you strip off the outside and start chewing on it. That's not going to hurt you. I forget how many feet of cane sugar it takes to make a spoonful of sugar, but you're not going to eat through that much stuff. You're just getting that sweet juice. It's no different than getting an ear of corn and eating a raw ear of corn. It's sweet. I like eating raw ears of corn. So basically, date sugar or any type of sugar, it depends on the refining process. How much has it been concentrated? We don't want the concentrated. When they make cane sugar, it starts with just, they run that cane through a mill and it smashes the juice out. Now I've taken a glass of that and drank it. It's delicious. It's sweet, but it's not like a glass full of sugar sweetened. It's just the way God made it. There's nothing wrong with that. But as they boil it down, and they process until finally they got this crystalline sugar, which is worthless. So what date sugar is, what they've gone through, my thoughts are, you take the date and you chop it up fine, you mix it with your food, you got your sweetener. It works fine. For me anyway.
I had a couple of statements, like about 4 years ago, I was supposed to get my knees replaced.
Mhm.
No, one, and yeah, both of them, I think. And so the church prayed for me, and I didn't have to go. I went back. I didn't have to do it. But that was what I want to say. Whenever I want to clean myself out, I use iodine salt, 2 teaspoons, and a quart of water from the store, and drink it, and it cleans you out. Is anything wrong with that?
I don't see anything wrong with that. You could take Himalayan salt and mix it with water, and drink a pretty good. See, basically, there's certain salts like magnesium chloride. We call that Epsom salts. We give that to people if you're going to give them hydrotherapy treatment because they sweat a lot, they lose electrolytes. We give them some sugar, some of this magnesium chloride, but you give them too much, it basically acts as a laxative. And basically that's what cleans you out. There was a man who was in the Hawaiian Islands, and he would make this thing called tutupai. Tutupai was, I think you'd take a liter of ocean water, a liter of distilled water, and a liter of regular water or some other type of water, and mix them together. No, boiled water, distilled water, and the ocean water, and mix them together and had people drink a gallon of that every day. That cleaned them straight out. And basically, we need to detox our bodies periodically. And whatever will cause you to diurese more and to defecate more in a medicinal way. Now, don't take E. coli so you get diarrhea, but whatever makes you clean out your colon, clean out your urinary system, clean out your lungs, clean out your liver, clean out your bloodstream, your skin, you're going to be a much healthier person. You mentioned, though, praying for your knees. I mentioned this man who was the president of the Children of Chernobyl, that man who had been, and he gave me his medal. He was so sick with radiation poisoning, they took him to one of the major hospitals in Germany, and he was dying in the hospital. One day, a group of people from an Adventist church came and said, and he was telling me this story in his living room. They says, "Can we take him to our church and pray for him?" The doctor says, "Well, he can die here, he can die there. Yeah, go ahead, it's not going to hurt him. He's going to die anyway." They took him out in a stretcher, took him to the church. Now this was, his description was, it was a big church with 3 balconies. They took him and they put him right in the middle of the church on the first floor, and the place was packed, and everybody prayed for that man. When they got done praying, he got up and walked out. And he was perfectly well. There is power in prayer. If we could just understand that there is power in prayer. And here he was sitting there perfectly healthy in this is Kherson, Ukraine. This was in 1995, and he just had this box of pictures. See, when Chernobyl, the power plant went down, the Soviet Union, to save face, they sent a man to the top of this tallest tower, smokestack, to put up a Soviet flag. He went up there, put it up, came down, and when he got down, he dropped dead from radiation poisoning. That fast, took him right out.
There's 2 more questions.
Okay,
One question is, what is the best approach to cure colon cancer?
all right. Like I've said a number of times, the best approach is to practice the prevention, which is you eat a high fiber, low fat diet. Now on top of that, you quit putting things into your body that's going to feed cancer, the things we talked about. You don't drink milk, you don't eat sugar, you take anti-inflammatories. We had a woman at a cancer seminar up in the mainland in 2013. She had stage 4 terminal breast cancer. We put her on curcuma. I had curcuma tablets because I'd had an accident. I had broken 7 bones. They gave me this for pain. I didn't take them. I gave them to her. This was in September of 2013. In August, she was given 3 months to live. She came to the seminar in September. She's still doing well. It's not just because she took the curcuma. She did everything we said. We've got to make our bodies unfriendly for cancer. We need to eat omega-3 fatty acids. We need to eat flaxseed, a lot of flaxseed. Take charcoal. Charcoal's going to go down there, reduce the inflammation. We need to go back to the diet that would have kept us from getting in the first place.
And piggybacking off that question, what is the best way to strengthen your autoimmune system?
You don't want to strengthen your autoimmune system, you want to strengthen your immune system. Autoimmunity is what your problem is. Basically, autoimmunity is when the body is starting to fight you. And one of the main reasons for this is our cells are becoming toxic. There's so many pollutants in our food, in our atmosphere, and when a cell becomes toxic, at a certain point, the body's going to start saying, that's an enemy, and it starts to fight it. Now, let's say something like rheumatoid arthritis. One of the main things that causes rheumatoid arthritis is the body fighting a certain food, a very common food, and it's going to affect the joints. So when we know somebody with rheumatoid arthritis, we say no tomatoes, no potatoes, no eggplants, no peppers, no dairy products, no tobacco, anything in the nightshade family, and that will, for 10% of the people, get completely well. For 25% of the people, they will improve. So basically, autoimmunity is find out what's causing the body to fight the body. My recommendation normally is you go on a fast to start with. If you feel like you cannot exist without any food, I say go on a mono fast. I think one of the best mono fasts for autoimmunity, it would be a grape fast. You get grapes, but you make sure they're clean. I've been eating grapes, I put them in a bowl, fill it with water, I pour some vinegar, I switch them around, I'll eat and sit. Then I rinse all the vinegar off. That's going to cut almost everything that's bad off there. And you eat grapes, nothing but grapes, I'd say for 10 days. And you're going to detox your body. We need to detox our body. We detox our body, we go to the onset and we sweat. We detox our liver, no medications, take things that are bitter. The liver loves lemons. We drink lemon juice in the morning. We put hot fomentations over it. We take charcoal to take toxins out of our bodies. We drink lots of water to detox our kidneys. We sit up straight. We breathe fresh air to clean out our lungs. And basically, if we do these things, we detox, often the autoimmunity will no longer be there. It will not always happen that way.
Two more questions.
Yeah, well, you got all kinds of
This is
answers.
from different people.
Okay, go for it.
So one question is, how can I control the desire to eat sugar? And the other one is, I had a friend that was vegetarian. He also exercised regular and ate raw foods. but yet he had a stroke.
Yeah.
He told me he should have stayed on his blood pressure medication. What are your thoughts?
Okay, well, if he just stopped his pressure medications when he still had high blood pressure without getting it under control, that can cause a rebound that causes the stroke. So what I tell people, and I tell you, don't stop your blood pressure medications until the doctor takes you off. And the doctor will take you off when he finds that, wow, your blood pressure is good to go now, and he'll take you off. But we wean people from these things. We don't just stop them cold turkey. Now, but the sugar thing, my recommendation is you stop cold turkey. I smoked for many years, and you have a craving for different things. You just have to sit there and hike up your trousers and say, I'm going to quit this stuff. Or you can replace that sweetener with another sweetener, like raisins or you know, things that are healthy sweeteners. But just because it's a healthy sweetener doesn't mean you're going to eat it all day long like you were eating your candy or your sugar before. It's got to be at meal times. But my real recommendation is go to Philippians 4:13. I can do all things through Christ which strengthens me. That was my little girl's favorite promise and a favorite verse in her Bible. We have to ask God for the strength to do these things, because inside of ourselves we have no strength. But we can do all things through Christ which strengthens us. Yes, sir.
Question. I heard you mention about the pumpkin seeds, unprepared pumpkin seeds. I heard you mention the term raw in eating. This person just also talked about raw. You can be a vegetarian vegan and your foods can be cooked or heated. What's your thoughts about cooking vegetarian vegan food versus eating raw?
The whole well, you know, many people. It's a big. I won't denigrate it by calling it a fad, but many people are on a raw food diet, which is perfectly fine. But there's a little bit of a problem with that because certain nutrients are released with heat. Our problem is we release them with a blast furnace and destroy them. But if you want to get better anti-cancer activity from a cruciferous, let's say the broccoli, you steam it. Because steaming it, see the phytochemical in broccoli is called sulforaphane, sulfur. It breaks the sulfur bond, which makes it more capable of fighting the disease. And so we recommend people, here's what I recommend people do. Eat some steamed broccoli, eat some raw broccoli. Basically, it tastes like two different foods, but they got a different complement of nutrients in there. Same thing with carrots. You know, you got your vitamin E, you got your beta carotene. So you've got some steamed carrots, and like I say, steamed, lightly steamed. When you lightly steam broccoli, it turns bright green. When it starts to lose the color, drink the water, because all the nutrients went in the water if they're still alive anyway. So we need to, I'm not against the all raw diet, but there's certain foods that you can't eat raw. You shouldn't eat a potato raw. You shouldn't eat beans raw. They are very bad. There's a chemical in those things that are going to cause, if I eat a bean that's not been cooked well enough, it tears my intestinal tract.
So what I'm hearing is raw is not bad. You just got to know when raw is good and when it needs a little heat.
They don't care about that. A person who's really into raw foods is going to be raw food. It's not when, where, what. They're going to be raw food. And now you can take a bean or a seed and sprout it. You know, mung bean sprouts. Sprouts are very healthy because, see, in the sprouting process, they've gone through the hydrolyzation process, and now they can be more easily digested. But, you know, I'm not ready for an all-food diet. I'm just not. I like my, certain foods too much. I like my pintos and rice. I'm going to have them. So that's just where I'm at.
Yes. I have a question. This person is asking that she heard you mention about you can put something in your mouth and you can sleep.
Charcoal.
Oh, okay. Yeah,
you put it between
get the name.
You
so
put
charcoal.
between the cheeks and the gums.
Okay.
It sticks there, and it's not gonna. You're not gonna choke to death on it. You put it way back there, it sticks because it takes up moisture and it just sticks. But it's going to slowly dissolve. In the morning, it'll still be there, sort of mushy. You bring it out, smash it up, brush your teeth with it, it whitens your teeth, swallow it. It's going to clean your intestinal tract. It's good
That's
stuff.
a charcoal tablet.
Charcoal tablets.
Yeah. 2 questions over
Thank
here. The first one is, what is the problem with the use of Lipitor's HCTZ melanoformin medications? And is fresh caught fish as bad for you as red meat or chicken?
Okay, well, the first one, medication, Lipitor, it's a, as I recall, this is a statin drug, I believe, a cholesterol-lowering drug. But whatever it is, my recommendation is, whatever the drug is, have the person go to the box, look at the side effects and the warnings, and ask, are these things worth taking the medication for what it's for? My recommendation is, what are you taking it for? What can we do with our lifestyle to take care of the problem rather than treating the symptom? Because basically the medications are almost always symptom-based. We got a symptom, we take a medication with its own side effects. I had a woman taking 34 medications a day. I went back and I took a PDR, physician's desk reference. I took a list of her admitting problems, and I looked down the list of her medications and the side effects, and it turned out she was taking almost every medication for side effects of medications.
Wow.
In one day, she was down to 4 medications. In 3 weeks, she was off of all medications, and all of her problems were gone because we changed her lifestyle. As far as the, what was the second part of that question?
It's fresh caught fish.
Fresh caught fish. All right, fresh caught fish. What was the water like the fresh caught fish was caught in? Okay, that's a rhetorical question.
Oh,
but
okay.
the fish in the water today, the water is polluted.
Right.
Not only that, almost every fish. There was a big article came out in there's a magazine called Popular. I'm forgetting the name of the magazine. Consumer Reports. This has been 25 or more years ago. I've still got it at home. And the researcher went around the world testing fish from everywhere, and he found that between 35 and 98% of all fish have cancers in their bodies.
Mm.
And most of your fish in your tropical waters are going to be full of parasites.
Mm.
And parasites is bad. I used to stand at the sushi bar until all the sushi was gone. But I wouldn't even touch sushi today because of the fact of the parasites in there. A big article came out in the newspaper years ago here in Tokyo, up in Tokyo, that said women who were lactating, nursing, and young children should not take fish because of the high mercury content.
This guy says, I guess it's fresh caught fish in the ocean.
Well, the ocean's what's polluted. Just ask Fukushima Daiichi about that. All the water that they're cooling the reactor with is going back out into the ocean, and it's showing up all over the place. But just because it's not going to be there, we've got effluvia from factories, from homes, from whatever, going into our water. So whatever the fish lives in, he's going to be taking it into his fat. And when we eat the fish with the fat, we're going to start getting the concentrated toxins. It's called biomagnification. I love fish, but I really feel like in the day in which we live, as much as I like it, it's not safe for me anymore.
This person said, wow.
Wow. Yeah, I say wow too. I mean, yeah, I'm not telling people don't eat it. If your choice is fish or a dead cow, I'd take the dead fish. But my recommendation is we try to move towards a more plant-based whole food diet. Because fish is going to have long-chain omega-3 fatty acids. If it has omega-3 fatty acids, and long-chain fatty acids, omega-3s, will promote diabetes, will promote overweight, will promote slow clotting of the blood. So it has its own complements of problems besides the cancer and the parasites that are going to be in there.
Another question, are there certain foods or fruits that is good to fight depression? Recently I heard eating something yellow and orange, pineapple and oranges for 3 days helps your moods.
They're good, but basically you need to get things that are high in tryptophan, that's going to promote serotonin. You need to get things that are high in omega-3s. Now, people in America want to get the fish for the omega-3s. You get your flaxseed, you get your nori, you get your tofu, you get your egama, you get your chia seeds. There's plenty of good sources of omega-3 fatty acids. Walnuts.
Okay.
Walnuts are high in omega-3s. Yes.
Okay, another question. My grandmother has diabetes, and she had this plant in her backyard, and every time she had a doctor's appointment, she would take the tea from that plant. And it's not only that plant. I hear many people, they say like, oh yeah, I am taking this plant because it's good for diabetes, you know, and there are also other plants that are good for high blood pressure. And well, in my opinion, I just felt like my grandmother was trying to deceive the doctor.
Yeah.
But what do you think of that?
Do you know what the plant was?
No.
Yeah.
Well, she just said it's an insulin plant. But
Well, here's my thought. If taking the plant before going to the doctor would modulate her symptoms, my recommendation was you take the plant every day because apparently it's doing some good. Now there's a tree. When I was working in Zambia, a friend of mine who's a real horticulturalist, he introduced me to the plant, and it's pretty common. It's called the moringa. The moringa. And basically he says that's the tree of life. You can eat every part of the tree, and every part is good for everything you got. He gave me some seeds, but I haven't done anything with them. But I really think that God has a cure for every disease. If we have to do two things. Search for the thing that's going to help with my disease, and two, quit doing the things that cause my disease. If we join those two things together, we wouldn't have disease.
yeah, so the problem was that some people, they are taking those herbs but not changing the lifestyle.
Yeah, if taking the herb to mask the symptom and then coming back and eating French fries and a Big Mac hamburger with high fat content, it's just, they're deceiving themselves, not the doctor, because they're not going to get any better. And if you don't get better at diabetes, you are injuring every cell and every organ in your body, and you will pay the piper. You will pay the piper. And you won't dance either because you don't have any legs anymore.
Another question. What is the cure for heavy or irregular menstruals?
Yeah, it's funny. In my training at UT Pines, there was always female doctors like Dr. Agatha Thrash, and I always sent women to her for that. But I know that I have a friend, when she went to Ukraine with us in '95, she would have these heavy menstrual periods, and charcoal helped her.
Charcoal?
Yeah, charcoal would help with that. But you know, frankly, I guess I've got to go back to my notes and read up because I just don't deal with those particular women problems. And so I'll look it up and I'll give you an answer, and they can email you back and ask what did he find out.
Okay.
Okay.
One more. Can I get it before you? What about this olive oil? Good, you know, if you take like a tablespoon day and night, I mean bedtime, when you get up, it's good for the joints. Refined. Is it refined? What is that? Doesn't
Cold
matter.
press extra virgin is probably what I think about. You know, I think that, you know, I don't really think that oil goes to your joint. You're not like a machine that you like the Tin Man in the Wizard of Oz. Now, I don't think taking a teaspoon of olive oil in the morning is going to go to all your joints and make them feel better.
Tablespoon.
What you need tablespoon, okay. That's not going to make your pancreas very happy, your duodenum, and anything else. Basically, if we have joint problems, it's usually caused by more dehydration, and it's caused by not enough fat in the diet, because our joints have synovial fluid, and if you're dehydrated, the body's going to take water from those places that are least vital for your life, which is going to be your synovial fluid. So pretty soon, we got the squeaky Squeaky joints, creaky, whatever they are.
Creaky and
If you have creaky joints, they start to hurt, wrap them with cabbage leaves or something. Cabbage leaves are very healthy for your joints. Drink more water, and if a person's overweight, it's going to be harder on their joints. They can drink oil all day, and it's not going to go in there and make them feel any better. And many people get pain in the joint because they start to accumulate uric acid crystals. They just got to get off the animal products, because that's where your uric acid is going to come from. Matter of fact, gout begins in the big toe because that's the furthest place away. They used to call gout the disease of kings, or the kings of royalty, the disease of royalty, and the treatment was they'd send them out to work with the peasants, working out in the fields, eating a simple food, got rid of the gout. So maybe that's the deal. So we're going to hire you out to this rice, to the cane field when it's ready to harvest. We'll send you down there with your bowler. You start cutting that stuff down, and you'll be fine in a few days.
If I survive.
What are your thoughts on spirulina, Epsom salt?
Is that two things or one thing?
It's two. It's like
spirulina.
Oh, spirulina. I'm sorry.
Yeah. Well, that's
And
fine.
Epsom
It's a good nutrient. Spirulina is a good nutrient. That's fine. I'm not going to buy it. It's too expensive for me. But if someone's taking it, I have no problem with that. As far as the Epsom salts, it's an electrolyte. If you're sweating a lot, you need to make sure you replace your electrolytes. But it can also cause diarrhea. So frankly, I've never given anyone an electrolyte when I've given a treatment. I've had one person in Japan, a student, who went into a carpal pedal spasm in a treatment. That guy he was freaking out. But that was just, it's not a major problem. It's sort of fun to watch, quite frankly. Cool him off, he was just fine. But here's a better idea. Basically, Epsom salts is magnesium chloride. That's 2 minerals. There are 84 essential minerals. Here's what I recommend you do. I got this from a chemist in South Africa, Yusuf Fontaine. He says, get some water. Doesn't matter how much. All right, make it easy. A liter of water. Half a liter, that's better. Warm water. Add some Himalayan salt. Stir it up until it dissolves. Okay? Add some more. Stir it up until it dissolves. It's going to reach a point of saturation. It no longer dissolves. At that point, you take a teaspoon of that water and you put it in a liter of drinking water and you drink that water. That has minerals are micronutrients. You just need a little bit. You're going to get a good complement of all the nutrients in that little bit of water in your drinking water. You drink that a couple times a day and you'll have, magnesium chloride, that's a big amount. A teaspoon of magnesium or half a teaspoon, that's much bigger than what you're going to get when you do it the way I just recommended, which is probably a better way to get your minerals.
Is there anyone who shouldn't be vegan?
Lions probably don't want to be, but they can be.
He's getting tired.
I'm going to shut the question down.
Questions tomorrow.
The bottom line is, there are people with a genetic, a C and an S deficiency that they don't process protein. Now, whether they're going to process protein eating animal protein, I doubt. Frankly, off the top of my head, I know of nobody who has to have an animal product. I may be wrong on that, but if so, forgive me. You can go online and find out what that problem is, and then we can address what's causing that problem. But if you're eating an animal, you're just eating vegetables secondhand.
Someone does have one more question. May I ask what vegetables and fruits I need to eat to gain weight?
Yeah.
You really understand.
Yeah. Tell you what, whoever's written that, whoever's typed that in, write on a piece of paper 3 words. Don't eat fast. That's how they gain weight. Don't eat fast. If you want to lose weight, put a comma after eat.
Stop.
Don't eat fast. You're not catching it,
Don't
are
eat
you?
fast. fast.
No,
Oh.
don't eat fast. Eat
Don't eat
slowly.
fast.
Chew your food.
Don't
See, many
fast.
people who don't.
Just fast.
See, if you're not chewing your food, properly breaking it down mechanically and chemically, some people, it just passes through the system. So we need to sit there and spend time masticating our food. When we masticate the food, then we're going to be able to digest it a whole lot better and take the nutrients in. Now, in 1999, I got down to 119 pounds. Right now I'm at 145 and I'm skinny as a rail as it is. I was down to 119 pounds. Dr. Agatha Thrash and Dr. Calvin Thrash, who are my neighbors and great friends, they said, start eating a third meal, take evening primrose oil, and start exercising because muscles are heavier than fat. And I did those things and I gained weight right back, but there was a fourth problem that they didn't address, but I realized what the problem was. I was in a courtship, and that lady was driving me crazy. I mean, I was stressed out the yin-yang. So basically, check your stressors. Check your stressors. What is it in my life that may be causing me to be thin? But here, at the end of the day, thin is in. Now I know that most people don't think that, but I've been thin my whole life no matter what. I used to eat frogs and turtles and rabbits and squirrels. But I've always been thin, and I hated it. But now that I'm in my 70s, I'm thankful. Because thin people live a lot longer than thick people. And my recommendation is be happy with it, but she needs to, whoever this is, and it's not so much the food that you eat, it's how well you eat it. Get a little bit more fatty food in there. Now, I'm not saying pour oil on it. Eat more avocados, eat more nuts, eat more olives. If you can get these things here, foods that are high in fat. Beans have a good source of fat in there. So we eat more of the good fat source foods and do some working out so that fat stays around and turns into muscle. We're going to gain weight. I mean, at one time, when I was in the Marine Corps, I was 170, and I was, can you believe it? I looked buff. I mean, as a runner, but I had a good runner's physique. Now, I talked about the Tin Man in Wizard of Oz. I could be the Scarecrow. You know. But, hey, my best friend died on my 60th birthday, and I'm 71. Thin is healthy. Yeah.
What are the best olives to eat? Because they all taste salty, and one tastes really, really. The little green ones, they really taste.
Well,
salty.
here's what you do when you get an olive that are salty. You soak them. Yeah, I know. Then it don't taste salty. So you really want the salt. So why are you complaining? Eat the salt. No, the black olives. Black olives usually the ripe olives. They usually aren't as salty. But they got that, I love the flavor of a black olive. Or, you know, yeah, that's the problem. They do. And if you want to get it out, you got to soak the salt out. And then it doesn't, you might as well chew on your eraser off a pencil. But, you know, it's...
They don't soak them so long, then just, you know.
Not so, yeah, don't soak them so long. And maybe that might be better.
Okay, I think we should call it a night. It is 9:26, and some of us just need to sleep.
Yeah, you especially. I don't know how you do it. We'll see you at noon tomorrow.
Probably.
So if all those people are watching this thing,
a lot of them, yes. I think some of them have checked
there are more
out,
people
but-
than there are at the church.
That's why you should start.
We should have done this every
That's
day.
what I'm talking about. You should do that, and then you'll get more people.
I'm much
You
more
won't
free
know
when I'm
who,
sitting
but,
here
you
talking
know.
to them. I don't have to look at people sleeping. I just look at that one-eyed monster.
Actually, tonight was your second highest rating since last night of attendees. So,
Well, it's good. And will that stay online?
Yes.
Yeah, well, that's good. So it's going to,
So I
You'll-
can take notes.
yeah.
Oh, I didn't have to be writing notes, huh? I can get it online.
It's good to have the notes.
Yeah, we need to close the prayer,
Yeah,
Please, okay.
Are you ready?
I'm ready.
You're praying, you don't want them on the,
Are they still there?
yeah, we
Okay.
still got some on.
Let's have a word of prayer. It's a great, and this is the Sabbath. I love the Sabbath. I need to open the window and hear the wind. I love to hear the wind blow.
I know,
But,
see
you
it.
know, Christ is above the storm.
Amen.
And he can be in us too at the same time. We need to ask him to be in us for this Sabbath day. Let's pray. Father in heaven, we are so thankful for the gift of your Son. We know that he gave up many things, one of which is omnipresence. But he sent the Holy Spirit to be with us. But he also sends his love. And I just pray, Father, that you would help us to reflect his love and your love for us. Your word says you have loved her with an everlasting love. And I thank you for that love, Father. And I pray that anything that was said tonight that was wrong, that was too fast, that stumbling over my words, that you would help people understand what's best for them, realizing that they are their own doctors, that they can take care of themselves, that they can seek you for advice because you're still the great physician. Bless us now. May we have a blessing on this Sabbath day. Protect us, Father, and all the people around us from this typhoon that's going to be hurling itself over the island, perhaps in the next few hours. Protect us. It may be the one person out there will meet their eternity tonight. They'll close their probation. I pray, Father, that we have not been slack in our duties about telling people about Christ. Help us to be your healing hands in this hurting world, we pray in Christ's name. Amen.
Yeah, a compliment. This was an excellent session. I'm looking forward to the session tomorrow. Thank you, OIC, for bringing Doc to the island. Marco is my hero.
Yes, he's my hero too.
I'm like, what about his wife? No.